Minutes. And yeah. Yeah, Megan's back.
Yeah.
You can tell I was waiting to say that for a long time.
Yeah. Yep.
How's it going?
Pretty good. I'm just trying to figure out if I should go sideways orientation. I don't know.
However you want.
What's the best for when you save it later?
That's probably the best because then we're both the same way.
Okay.
It'd be kind of fun if like one was upside down, but I think
This makes more sense. Okay.
this is probably the best. I'm just gonna start my meeting on the Zoom. I should probably stop saying the Zoom, but
Yeah, it shows your age.
I guess yeah, I look a lot older these days. A lot more gray hair.
Showing your age on the Zoom.
Yeah. Well, we got some big news. I think we're gonna be opening soon.
Yeah, that's so exciting. That's awesome.
Yeah, it's like we don't really know what's happening because our college hasn't made a statement yet because they have to indicate how we're supposed to conduct business and stuff like that. So
Yeah.
yeah, I don't know what's gonna happen with like PPE and like how do you get masks at this point and
Right.
Yeah.
Yeah, and then we're recreation centers sitting in stage 3, so
Yeah, so hopefully like the good news is if like the rates don't go up and it's managed, then things can be progressed a bit quicker, but we'll see, I guess.
Yeah, so everyone followed the rules so we can open up
Yes,
our
please.
center.
I want everything to, at least like some of the summer can be, I don't know what you want to call it, like somewhat normal.
Like salvaged a little bit, like, yeah.
A little bit, like, I mean, you can still like ride bikes and stuff, but I don't know. It's nice to gather a few people. At least at a park when they're open, you can like sit far apart and like yell at each other or something.
Maybe no high risk transfer things like beer pong and stuff.
No.
We're literally sharing
Yeah.
like ping pong balls and cups.
Yeah, I mean, or even playing frisbee together. I guess you could wear gloves or something.
Yeah.
Even then.
Well, I know that like our rugby season has been pretty much canceled indefinitely, so that's pretty sad for people who are still playing. I'm retired basically.
Yeah.
So it's sad. I guess I don't get to sit on the deck and watch rugby games all summer, which is my favorite activity.
It's tough. Yeah, it's actually it's tough because we were supposed to work with St. Albert Rugby as well. And helping out, like we made contact with them and it was a good conversation. So we were like super pumped. We were going to work with them and like a couple of soccer teams.
Oh yeah.
So this summer was like, initially when we kept signing up for everything, I'm like, you know what? Let's just say yes to everything and deal with it because that's how my life works and it's always led to like decent things. And the problem is like we had so many things and I'm like, we could realistically do it all. And I was so pumped for the summer, but also kind of scared because I'd be really tired. And then all of this happened. So that all went away. So now it's like a summer that's free, but I don't want to be free.
Yeah. So free when you can't go anywhere, really.
Yeah, like I can't. My mom's like, "Oh, come drive down to Vancouver." I'm like, "Well, technically we're quarantine and this and that." So, do you save these videos for the peeps who are working now? Yes, we do. So, good question. We do have a YouTube page. Pursuit of Motion Physio is the YouTube page, and I usually upload all these videos within the same day. So yes, they are all saved on our YouTube page. You can subscribe if you want or just check up on it. But yeah, they definitely, sorry, I'm just looking at a message on that side. They're definitely saved. These are gold. So now it's kind of cool because I was like, wasn't treating it while I was doing tele rehab and this patient had headaches and I was like, well, check out our headache YouTube video.
Oh yeah.
So now I refer, and then we have like that workout we did with the U of A. We did like a stretching program and a HIIT workout for people who work from home. And that video got like 60 views in like a day, which is really cool. So
yeah, that's awesome.
Yeah. So yeah. I had a message from Steven. You should not check the COVID box. Silly. It's all your fault. Don't know what that means, but yeah. Did you want to review anything? I do have the slides ready.
Okay.
If you want to review, like do a short review, or just get straight into the exercise, your call.
Well, we can get straight to the exercise. I know, like at the beginning of the slides, where we left off, there was and how to do diastasis recti, diastasis recti. I say DR mostly, so I kind of butcher the word. At the beginning, a self check. So obviously, again, sorry, my name is Megan Kroschinski. I'm a Mind, Body, and Special Populations Programmer at Service Place. And I really love working with pre and postnatal moms and getting them back into fitness following, you know, any kind of recommendation for pelvic floor health, and working with a team such as physios, massage, chiro, whoever you are working with, pelvic floor physiotherapist, and getting you back into your old fitness routine that you were in pre-baby, or trying to get to some kind of state like that. So where was I going here? So yeah, so today we're going to be going through exercises that you can do safely, starting on your fitness journey, and then also as you progress, and different ways to modify if you have certain pelvic floor dysfunctions, pubic symphysis dysfunctions, and different things like that that you may be struggling with post-baby. So would you be able to show the slide, Sunny, where it shows the DR self check?
I
so
can
again,
pull that up.
Because I'm a strength and conditioning coach, but with also experience and certification in pre and postnatal fitness, it is out of my scope of practice to diagnose. Again, it is the job of a doctor or a physiotherapist to diagnose. So generally, this wouldn't be something that you would find out from your trainer. However, I do get my classes or clients to do their DR self check. So I will show you today how to do that. If you've never been to a pelvic floor physiotherapist, or no one's ever told you if you had DR or not, I know that was never something that was identified to, say, my mom. So my youngest brother was born 16 years ago, and that was never something that was communicated to my mom by any doctors or nurses. She never knew anything like that. So obviously pelvic floor health is getting a little bit more, pelvic floor and just abdominal health pre and post baby is getting way more talked about now, and more professionals are identifying it for women. So yeah, as a strength coach or trainer, I would generally either refer you to a physiotherapist to get a diagnosis, or get that diagnosis from the physiotherapist and work with it at the gym. So
I'm gonna do screen sharing here. So 1 second. I'm gonna screen share with Zoom as well. There we go.
Oh, awesome. And then I think it starts getting into the pictures as we go on. So again, so DR or diastasis recti is a little separation at the linea alba in between your rectus abdominis, so those six-pack abs that are either showing or they're somewhere under there.
Mine aren't showing.
Mine aren't either at the moment. So it is a separation caused by internal pressure and changes in hormones in your body. Generally with relaxin, things start to soften, joints, ligaments, they start to soften and prepare for delivery of baby. So while you're pregnant, so you can generally in the later months of pregnancy, you start to see that, or some people don't, but you start to get some sort of separation. Sorry, my front door was like opening, but it's just the screen.
Oh, no.
I was like, who's here? So leading to that, things that can lead to, maybe issues, maybe not issues, but generally it can lead to some pelvic floor dysfunction. It can lead to incontinence. It can lead to lower back pain. It can lead to vulnerability of your internal organs. So we definitely want to know, as a trainer, trying to get you back into your fitness routine, your goals, other things you want to do, maybe your sports that you're still wanting to play. That is super important that we identify that and that we refer you to the right person to identify it and then work with you on the way up. So I'm going to show you, I'm going to hopefully fit into this whole screen here, the DR self-check at home, or what we might do with you at the gym. If you've never been told that you have it, then we kind of do a self-check. Again, we would never diagnose, but it's good for you to know. And it's good for, if you are expecting to try and get pregnant, to kind of have a baseline of where you think you are right now. And then you can always keep track, you know, through your pregnancy and then after. So generally what you would do is you'd lay flat on your back. Oh my goodness, are you able to see me, Sunny?
Yeah, I can see it for sure.
So flat on your back, head is relaxed, everything there. So you want to get into more of a crunch position, but before you do that, you're going to find your umbilicus or your belly button, and you're going to feel around there. So you're really going to have to put the fingers, get your couple fingers, 1, 2, whatever, and really find that belly button and right above it, okay? So from here, all you're going to do is lift your head and shoulders, and you're going to do a little bit of a crunch, just a tiny crunch, because we want the rectus abdominis to be under that pressure and be working. And you can feel around either about a centimeter above the belly button or the umbilicus, and you can move up the linea alba. However, it will probably show more above the belly button. And you try to see, do you have like a 1 finger separation, which might be normal for you if you've never been pregnant. That might be your normal starting spot. Maybe there's 2 fingers of a separation. It might feel like, so it feels like a little bit of a dip. So the muscles obviously come out, and then the linea alba dips in slightly. So you can feel around there.
Yeah, nothing for me.
What do you feel? Yeah, you don't feel anything, so okay. And
I feel this really like soft thing there, large and soft. And just...
It is possible for men to actually get it as well. Generally, so what I've read, I've never seen or experienced it yet, is like, you know, someone that does like 100, maybe not so good form crunches or sit-ups a day, you can get that like pressure, that abdominal pressure on the wall, and get some kind of separation. Have you ever experienced a patient like that, Sunny?
Yes, I actually did. I was fortunate enough in one of my practicums to work with a pelvic health specialist, and like with consent, obviously, I got to palpate and stuff, and did work with them in that context. I mean, here not so much, but yeah, definitely like heard about it quite a bit and have seen it a couple of times. Yeah.
So some people can experience no separation. I was lucky enough. I only was pregnant until 8 months. I was lucky enough I did not experience much of a separation there. However, I have worked with clients that even have a 3-finger separation. So 3 fingers that their rectus abdominis has come apart around their belly button. So, and they did work with a pelvic floor specialist very strictly, and then also came to us as well to ease back into their strength exercises. And although she only saw some return to normal, I want to say more of a return to functionality, because it doesn't always return to normal. Mm-hmm. She was able to slowly get back to her old fitness regime with exercises that we're going to show today.
Yeah. Okay, cool.
So we're going to get into some here. So if you have something like DR or any kind of dysfunction around the pelvic floor, again, as a trainer, we can't just guess what your pelvic floor is like. So that the bunch of muscles underneath your pelvis that you're sitting on right now, that's holding kind of everything in. So that area where, you know, where the, it's a diamond almost, where the anus is, where your pee comes out of, all that area down there. So pelvic floor down at the bottom, where baby's going to be pushed out. So we don't know as a trainer what type of dysfunction you may or may not have. Is it really tight? Is it really weak? And that, again, is something that you need to work with a pelvic floor physiotherapist first. However, most trainers, especially after baby, we're going to assume that it's weak. That's just what we're going to have to assume. There's not really much other than you telling us from a pelvic floor assessment what maybe you have. So we'll always try and work with pelvic floor first thing with a client. So you can sit. We're going to try and find pelvic floor first. You're going to sit cross-legged. And if you've never done this before, it might be kind of weird thinking about that area. So right now, your pelvic floor might feel really relaxed. You might feel a sensation that maybe you have to pee really bad right now. And you might feel a sensation that you're holding it, but maybe you're relaxed and you just feel like really relaxed down there, like you're pushing out. So we're going to try and find it here. So you're just going to sit up nice and tall, and we're going to focus on breath first. So all we're going to do is really focus on 5 inhales and exhales, and I just don't want you to think about anything except the breath. So let's do that. Inhale and exhale 4 more times. If you're doing this at home, you don't need to be on the floor. You can be in a chair. You can be anywhere. Okay, so relax there. So the next thing we're going to do is we're going to try and pair our pelvic floor movement. So we haven't done any pelvic floor movement yet, but we're going to try and start to get our pelvic floor and match it with our breath. So on the inhale, we're going to relax. We're going to fill our body with air like it's an expanding balloon. So whether it's coming out in all directions. And then when we exhale, we're going to push the air out of the balloon. And in order to push it out of the balloon, we're squeezing the core and we're also pulling up on that pelvic floor. So I just want you to try it now. We're just going to try it with that visual. So inhale and exhale. Squeeze the air of that balloon with everything you have. Good. Inhale. Exhale. Squeeze the air out of the balloon. Inhale. And exhale, squeeze that air out of the balloon. One more time, inhale. And exhale, squeeze the air out of the balloon. Okay. Other than lightheaded, if you do feel lightheaded, if you're able to kind of get that pelvic floor to really push up on that air, great. But if you weren't able to feel that, we're going to go to the next kind of phase of cueing. So this time, what we're going to do is I'm going to give you 3 different visual cues you can have. You can have an elevator, so utilizing that pelvic floor and thinking of it as an elevator. It's getting pulled up by a rope through your spine, and it's pulling up as you exhale. Number 2, you can choose a jellyfish, which I really like. That one's mine, my good cue. So you think about your pelvic floor as a jellyfish as you exhale. So it's doing this motion and coming up. And number 3, you're going to think of the milkshake cue, so sucking a really thick milkshake through a straw, and that's how you're going to bring that pelvic floor up, okay? So we're going to pair it with our breath. So again, inhale and exhale. You're going to elevator, jellyfish, or milkshake. Inhale, exhale again, pulling that up. Inhale. Exhale. One more time. Inhale. And exhale. Good. Sunny, did any of those cues resonate with you?
I like the jellyfish, to be honest.
Do you? Okay.
Yeah, I think that definitely, that helped me get it a lot more, for sure.
That's good. Everyone has their own kind of poison that they need. So the next one, if those cues didn't resonate with you as well, the next one what I would say is get some kind of feedback. So whether you have a nice yoga block or whether you have an exercise ball, and maybe you have neither of those at home, the next thing you would use is a towel. Like, so rolling up a towel and sitting on it. So And it could even be something as simple as your chair at home. It doesn't necessarily need to be a rounded object, but I do like the rounded object because it gives that upward feedback motion. So we're going to go through the breath 3 more times, and hopefully this is one of the cues that helps, although I have a plethora of other cues that sometimes I need to help with other people. And again, this isn't something that you can always get right away. If this is not something that you've done before, it does take time. So sitting in that ball with that pelvic floor feedback, you might feel it already. Sit nice and tall. I want you to inhale to prepare and exhale. That ball pushes against the pelvic floor. Lift it up. Good. Inhale to expand and exhale. Ball pushes against the pelvic floor. Inhale and exhale. Ball pushes against the pelvic floor. Did you feel that, Sonny?
Yeah, I definitely did. That makes it a little bit easier for sure.
Yeah, I would say for people that need more of a tangible physical feedback, that's probably the best one to do, especially as a trainer that doesn't have the clearance of a pelvic floor physiotherapist to help with maybe an internal type exam, which is never going to be a part of my scope of practice. That's always going to be part of the pelvic floor physio's scope of practice. So pelvic floor is a huge one. Those are some of my cues that I would use. The next one I would also go into is teaching someone how to connect with their transversus abdominis. So that's what we're going to do next. We're going to get back onto the floor. And then we are going to go into more exercises that then resonate with the pelvic floor and TA. So we're going to go back into that laying back position. We're going to find our TA first by finding our hip bones. So the hip bones will be on both pads of our thumbs, and the thumbs will come together and the 2 pointer fingers will come near pubic symphysis. So it's going to be a diamond on your pelvis here. So you're just going to find that first. And actually, what we're going to do, let's do anterior and posterior pelvic tilt first, and then we'll do TA. So laying back here, your back is nice and flat. All we're going to do is we're just going to tip the teapot or the teacup forward. So lifting that lower back off the mat. Good. So you're spilling the tea to your feet. Then you're going to bring it back to neutral so the tea is not spilling. And then you're going to tip it forward to your face. So spilling the tea towards your face. Good. Bring it back to neutral. Tip the teacup so the liquid is spilling out. Good. Bring it back to neutral. And then tip the teacup forward towards your face. Keep that going as you move through. So we're just doing a little bit of pelvic tilt control here, which will be huge in some other exercises we do. Good. Let's do just one more back and forth and then back to neutral. Finding that low back flat and relaxed on the floor, just in a neutral position. So from here, you're going to find those hip bones again. So find those 2 bony protrusions on the front of your hips there. Good. And from there, you're going to just trace your fingers inwards to where it almost wants to fall in. So there's nothing pushing back. There's no bone. It's just really push into your inner sides here. It's like you want to almost grab that pelvic bone there. So from here, we're going to try and find those TAs. So it is a little bit deeper in your body. So this is where I can try and find it. Lay back nice and relaxed. The first thing you're going to do is just cough. So from here, just cough. Did you cough? So if you felt something push up against you, that is the TA. It is pushing up against you there. Great. So you were able to do it without thinking about it. It just automatically happened. So the next thing we're going to do, keep those fingers really pushed in, is we're going to blow out 100 candles on a birthday cake. Okay? So I want you to inhale and exhale. Did you feel any kind of feedback pushing back on your fingers? So if your fingers are in the TA there and it's nice and soft, all of a sudden it hardened up and it pushed back against your fingers. Did you feel that?
Yeah, I felt it kind of like a cough.
Okay. So let's do that again with the candles, because this time I really want you to dig deep. So if you didn't feel it with the candles, I really want you to dig deep with that breath and really push against the fingers. So inhale and exhale. Push against the fingers. Good. Do you feel that muscle pushing up and getting hard against your fingers?
Oh yeah.
Okay. Awesome. So you found TA. So now, can you, without really doing any of that breath, try and activate or tell that TA to turn on without doing any of those, focusing on just that cue. So just doing a normal breath, inhale and exhale. Can you turn that TA on and hold it there by yourself? So try that. Again, this one is, I can verbally explain it over the camera. It is tough as well. If sometimes as a trainer, I will ask if someone does need help, and then they say, hey, like, can you feel if I'm activating it? And I do try and palpate if they're comfortable with it, but I do ask them first. And obviously in this COVID world, that might be a barrier to our sessions, because we are probably going to do a little less contact in personal training than previously. Okay, so we are going to stay lying on the floor, because the next thing I want to do is pelvic tilt and paired with a hip extension. So a lot of people will do hip extension exercises and really not think about anything else that they're utilizing, but it's super important for pelvic control, anterior posterior tilts, pelvic floor, TA. You can work all of those. All right. So we're going to go back down into our laying back position, a lot of laying back positions. And all we're going to do, we can find the teacup position in the diamond, or we can have our hands beside you if you already feel like you have good pelvic control. I'm going to keep these on just to show. Feet are flat on the floor, knees are bent. All we're going to do here is we're going to tilt the pelvis towards you, so spilling the T towards you. And then we're going to activate, push up at the hips using the glutes. Good. And then vertebrae by vertebrae, we're going to lower it back down. That pelvis is still tilted towards you. And then as we stamp the ground with our sacrum or our lower back, we bring it into more of the anterior tilt and then back to neutral. So it's a lot more mental sweat than you think. All right, from here again, find that diamond, our hands beside you. We're just going to tip the T towards you, posterior tilt, push up at the hips. Good, and we're going to lower it down vertebrae by vertebrae with control. Stamp that sacrum down onto the ground, rock it, and back to neutral. Good, bring that back, tip the T towards you, push the hips up, lower it down vertebrae by vertebrae. Good, stamp the sacrum, tilt posterior or anterior, back to neutral. Good. Let's do two more. Anterior tilt, push the hips up, control it down, nice and slow. Good. Rock the hips, stamp, and back up. One more I'm going to do with no instructions, do it on your own. Good. And relax.
That's a lot harder than I thought it would be.
Yeah, there's a lot of concentration to that, and especially too, if you're pairing the layers of focusing on pelvic floor, which I didn't even really give that cue for because I was mostly focusing on the pelvic tilt. But once you start thinking about the pelvic tilt, you start to link those things. You start, like, if you've worked on pelvic floor exercises in the warm-up or the activation stage of your workout, your brain starts to work, and it's like, okay, like this naturally feels like I'm gonna activate it when I'm exhaling or whatever. Like it starts to all come together. So those are really good because pre and postnatal, we really want to focus on posterior side of the body as well. So getting in those glutes and the hamstrings, super important. Especially because those glutes start to get a little bit lazy and the hip flexors start to get tight, especially with the anterior pelvic tilt. Once belly gets starting bigger, getting bigger, and then you're always holding baby. I know, like, that's still a thing for me, like neck pain and back pain from holding my 1-year-old. So I got to work on that. But staying on, we're going to keep moving here. We're going to still, I want to keep on going now with the glute activation work. Still thinking about pelvic floor. So let's come on to our side here. And I posted this in one of the pictures. So generally, clamshells, everyone wants to put a band around their legs. They want feedback with the band, which is fine. I think as you get stronger and you grow into that, and especially if you're coming into your fitness journey and, you know, you're really getting good at this, that's great. So trying to fit my whole body in here. So from here, what I like people to start out with is getting their feet in a fulcrum point here. Oh my goodness, let's move all this stuff. So feet are together at the fulcrum point, and we really want to work on the glutes here, and I want to try and find the glutes. I mean, sometimes it's difficult for people to really just find that glute min or glute med that they want. And when we open the hips, when we exterior rotate the leg, we just want to think about the glute working. And so we're not trying to open up the entire hip, because really that's not what the goal is here. We really just want that glute min and that glute med to do the work, and the glute max, I guess. We don't want it just to take over. We want it to exteriorly rotate the hip. So just with little movements. And I like to do this with everyone in a lot of my regular workout classes, because again, it really gets them focused on that rather than trying to open up the entire hip and really pushing against some kind of resistance right away. Just really thinking about it.
I like how you mentioned that, because I cue a lot of patients like that for clamshells of any type. So
yeah,
that's why like a lot of people do it, like, oh my gosh, I feel it with no weight. I'm like, yeah, even me, I got some like a decent burn in my hip. So
yeah. So if you're still watching and you did one side, do the other side. I'm just going to start talking about the next glute exercise. So another glute activation exercise that I like for postnatal and prenatal. Prenatal is harder, especially if your belly's getting a little bigger, is a glute extension. I don't really have a name for it, because I actually, I learned this from a yoga therapist, a really awesome woman by the name of Suzette O'Byrne. She came and did a little session for us at service. And so this is a really good glute extension exercise. So you come into a plank. And when you're in the plank, it's kind of almost like, it's not a flow plank, it's a pigeon style plank. I guess I could call it that. It's really hard to fit into this screen here. Okay, so you're in a pigeon style plank. So you're on your forearms. This leg is underneath you. So it's not exactly a pigeon. It's just underneath you, holding you. Come into the plank portion. And then from here, your toe is actually, oh my goodness. How am I going to do this? Can you see my toe? I'm going to have to do this kind of twofold.
I can see it there.
Actually, I'll do this. Yeah, this is better. Okay. So you're as flat as you can be, almost in a plank. Toe is nailed to the ground, and knee is resting on the ground right now. So from here, again, you're going to kind of see where, if someone's pregnant, this would be hard to do, but postnatal will be a little bit easier. So all you're going to do is you're going to make your brain think you're trying to lift that leg off the floor. However, you don't want to lift it off the floor. You're going to trick it and say, I want to lift this leg off the floor. I'm trying as hard as I can. I'm not moving anything except extension at the knee and relax. Bring it back down. So extend the leg so it comes nice and straight like you're doing a plank. Try and lift that heel up into the air, but you can't. Just lift, 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 and relax. Good. Extend really hard, trying to make those glute, hamstrings, everything work. Good. Relax it down. Let's do 2 more. Extend it up. Trying to lift that off. Good. Back down. And 1 more. Extend. Trying to lift that leg. Is that glute speaking to you now? 3, 2, and 1. Relax. Good. So we'll do the other side. And usually people will have one glute that speaks to them a little bit better than the other. Again, prenatal, this might be difficult. And then also too, if you do have pubic symphysis dysfunction, it might bother you depending on what position it puts you in the pelvis. So I try and let people know that they can do it standing as well, although it's not the exact same, but even just with the standing extension, like really controlled, not letting the hips move forward, you can kind of get your glutes to speak to you as well.
Yeah. No, that's a good one. I definitely felt my glute.
Yeah, and I like that one for activation before any kind of like leg exercise in general.
Yeah.
It's really good. I think people should continue to do it as their full fitness journey continues. I'm just trying to see here. What else do I? Okay. So that's some glute activation stuff. So glute activation is super important for pre and postnatal. What I want to do is go back to a little bit of the diastasis recti, so the DR. So a huge thing to know for trainers and for people wanting to get back to their fitness routine is you want to rest that area. So initially, if you do have some sort of separation, rest is your best friend. So obviously the recommendations in Canada right now are 6 weeks postpartum, and then you can start to do exercises. However, you can actually do pelvic floor work within that. But if you're wanting to try and, work on those abs right after, I want everyone to make sure that that's a stop, that's a rest space. And until you are ready to, you've been cleared by a doctor 6 weeks postpartum, you shouldn't be starting any kind of ab work right off the bat unless it's breathing work or pelvic floor. So again, resting that rectus abdominis, and with trainers, what we would try and avoid is anything that would be straining that rectus abdominis. So any kind of plank, any kind of push-up, potentially even any kind of incline row, depending on your strength in general overall. But we'll get to that. So what we really try and focus on is the obliques, the TA, and the pelvic floor. So anything around it. And I said this in the last one. So if you injured your Achilles tendon one day, the next day you wouldn't go and run stairs. So, and you probably wouldn't run stairs for 6 to 8 weeks. So again, rest is huge, and you'd be strengthening the things around it. So you might be strengthening the quads, the hamstrings. You'd be avoiding the calves, since the calves come down into that Achilles tendon. So I want everyone to try the side plank. So a lot of people do side plank. They automatically want to do this. They're like, yeah, side plank, woohoo. I really love this modified side plank, even now, even a year postpartum, where you are down on your forearm. You also have one knee behind you, so you are not necessarily just like this. You have one knee behind you and one leg is straight out. I'm going to try and move back so you can see more here. So what you're going to do is really focus on pushing that back shin and that forearm into the ground. So as soon as you really try and push those into the ground, you're really going to start to feel those obliques work even more here. And what I like about isometric abdominal or core exercises is that you can also focus on your breath here too. So you can inhale, adding that other layer, and exhale, pull that pelvic floor up. Inhale, relax, exhale, pull that pelvic floor up. Inhale, relax, pull up, or exhale, put that pelvic floor up. And let's rest here. So I really love that side plank because A, you can focus on the obliques, and then B, if you need it that next level harder, then bring pelvic floor into it. And that's what I like to remind the postnatal moms is like, okay, if you're getting used to this movement and your body is responding to it great, okay, let's add the layer of pelvic floor in as well. So yes, that's a really good core oblique exercise to do to help avoid that rectus abdominis. If you went to a pelvic floor physiotherapist and you were not diagnosed with DR, they say, okay, you're good to go. You're 6 weeks postpartum. Let's slowly like build into your routine. Then you can work on things that stress the rectus abdominis. However, you want to be smart about it. You're not going into full leg raises. You might be starting out something simple like dead bug. So getting flat on the back. Again, really thinking about keeping that back nice and flat on the ground. Feet, or sorry, legs are at a 90-degree angle. Arms are up in the air. Oh, maybe I should angle myself better. That will be good. Feet are up in the air, hands are up in the air. We want to start with just lowering the legs to where it's comfortable. And as soon as that lower back comes off the mat, that means you are weak in those rectus abdominis. And ladies, if you just had a baby, you probably are weak there, and that's okay. Keeping that lower back flat is actually what's most important for you right now to focus on. And then adding in the arms after, once you've been able to work on that rectus abdominis strength, is really good to add. Just do one more each side. All right. So I like to look at dead bug as a good starting point in working up. There's a couple other things that I would look at. So even though you might not have DR, again, you just carried a human in there for 9 months. You have ligaments, you have that have been stretched out. You have other muscles that have been under some sort of stress for a long period of time. You've had ribs, you've had your diaphragm, you've had your lungs have been displaced, potentially, depending on how your baby grew. So there's definitely things in the core and the trunk area that are not going to feel right, that are going to feel weak, I want to say. Just different right now, and you might not be at a point where you can successfully complete 12 dead bugs. You might be going by how your body feels and how your body's reacting. So maybe you're only doing 4, and then maybe the next set you could complete 6, and maybe the next set you could complete 5. So I don't always prescribe number of reps all the time. So those are some of my more intro exercises, and I would still keep ladies going even as they even as they progress, there's my word, progress through my classes. But they would always still revisit those exercises because they're so important to do. So I want to talk about the squat and moving back into something like a squat while thinking about pelvic floor health. So I'll get you to stand up. So the thing that we are told, especially as someone who might be a heavy lifter, you learn about the Valsalva maneuver and how you're kind of pushing out against a belt or against like a restraint that you might have to help stabilize the trunk to pull up against heavy weight or push up against heavy weight. But sometimes lifters don't always, or people who are lifting weights don't always think about what they're doing with their pelvic floor. So you might be forcibly pushing a weight up, but then also forcibly pushing your pelvic floor down. And if you've just, if you're in the process of recovering from birth, especially, pushing down on the pelvic floor is not, it's going to be detrimental to your progress. You probably won't hurt yourself if you've got some sort of recovery, but it won't help with your progress and healing. So what you really want to think about is really being able to activate that pelvic floor and pull it up while you are in the squat process. So I want everyone to stand feet shoulder width apart. Again, I'm one of those people that's like, you squat, what's best for your body. Everyone has different pelvic angles. Everyone has different ways that the head of their femur fits into their pelvis. So many different things. Everyone wears different kinds of shoes. Maybe they're minimalist shoes. Maybe they're Olympic weightlifting shoes. So you squat what's comfortable for you. Maybe your feet are forward. Maybe they're slightly turned out. Whatever. So find what's comfortable. And what you're going to do is you're going to inhale to just prepare yourself, and then exhale, pull that pelvic floor up. Good. So as you're exhaling, so inhale to prepare again, and exhale, pull that pelvic floor up, sit it down, and then push up at the same time. Good. So inhale, exhale, squat all the way through that exhale. So that might sound a little bit counterproductive right now, especially for lifters who like to hold their breath during it, which is fine if you have that pelvic floor control. But for right now, we're just teaching someone how to control that pelvic floor all the way through the squat. So inhale, prepare, exhale through the squat with that pelvic floor up. Good. Inhale, relax to prepare, and then exhale all the way through. Good. So let's try it 3 more times. Inhale and exhale. Good. Inhale, relax, exhale. Good. One more time. Inhale, exhale. Good. All right. So again, it's like a lot of the mental sweat, but for someone that needs to be more focused on what their pelvic floor is doing through their bigger, I want to say core. Squat is a big, large core exercise. You really have to be aware about what it's doing through movement. You might be someone that is on the road to recovery from a prolapse for any one reason. And definitely pushing out on your pelvic floor is not going to be good for and conducive to trying to do a squat, whether it's body weight or with resistance. So I really try and teach the postnatal moms, especially, how to do that while they're squatting. And it's really good. I found myself very good success with it, especially. So
I find like lots of things waking up in my core, and I like the cues. The cues are like awesome. I'm gonna use like everything that you just.
Good. I'm glad. And I feel like I have so many I want to say, but I want to get through everything too.
Like the teacup, and I'm like, this could help me quite a bit, and even other injuries that I see. So yeah, I like that. I like the teacup one. That's one I never actually tried before, which I guess makes a little bit of sense maybe, but.
That's awesome. That's awesome. I'm so happy about that.
I like that. I'm definitely excited. I'm like, I definitely feel my core right now.
That's good. So something similar as well with Romanian deadlifts or stiff leg deadlifts, that'll be super important for just posterior strength anyway. So hamstrings, glutes, lower back, upper back, everything. And again, trying to pair that pelvic floor in there as well. So you can slowly get back to those strength exercises I would say at a relatively fast pace, because body weight movements are still challenging, especially if you're trying to get someone to focus on their breath, their pelvic floor, their TA, and all of those. So some other ones I want to show. So obviously, most people, I would say, have this issue with some kind of rounding of the shoulders, neck pain, back pain, but especially for postnatal moms, again, because of the pelvic tilt, the position that their pelvis is putting them in. Then once baby comes, maybe it's, body composition changes around the breast area, or even just like holding baby lots. I know myself personally, it was definitely, I had a lot of major neck and back pain when baby was newborn, first 3 or 4 months, and all he wanted to do was be healthy. It was definitely a struggle. So really try to correct that kyphotic area around the back and the shoulder rounding. So again, obviously a lot of good chest and anterior side of the body opening. So doorway stretch, having your hand in the door, stretching that out, great. So the next kind of things I want to show is how to get those shoulder blades moving and the your back working to strengthen and open that up. So I actually don't really have anything to attach this to. Oh, maybe this. So, well, I don't have anything to attach this to in here. So if you have a band, which is awesome, really focusing on a row. So I'm just going to do it without the band. So pretend there is a band in my hand. So what I like to start all my postnatal moms with, and they're usually standing in a nice athletic position, but I'm just going to show you from seated here, is really just thinking about that, the shoulder blade movements. So the scapular movements of the scapula, and I always say that's the baseline movements. Perfect, Sunny, you rock. But I'm going to keep them with no elbow bend, and all I'm going to do is get them to move the scapula, so protract and retract. Maybe I'll start with one arm or two arms. It depends on, you know, where they are, their brain is. Sometimes it's hard to get them to really focus on both, so I try one at a time. Get that protraction, retraction without any elevation, depression, just the protraction. Good. So I would generally get them to do 10 of those, and I generally do it in the beginning of a workout or session, in their activation phase. Again, I don't always just call it a warm-up. It's an activation phase first, and then they might do some sort of a warm-up. Yeah. So I really like to do that first, and then to get their brain connecting with that, with the rhomboids, then I would add the elbow bend in. So it would be the protraction, retraction, bend the elbow for the row, good, extend it out. There, bend it in for the row, extend it out. So again, I get them to do this a little bit chunkier than one would expect. You might want to just go into the rows, but it's really focusing on the protraction, retraction, letting those shoulder blades out, pull it back in, and really teaching those shoulder blades to move over the rib cage. They might feel little cracks and pops, and it's really good. It's really good to start getting into that rowing strength build up, and then also helping for pain relief. I would also do something similar with an overhead lat row. So I might do it with a stick, or I might do it with a band over, I'm trying to think, in our, like a door maybe in your house. We have a squat, like the squat rack like that. But all you would do is I would get them to just with straight elbows, and I was an Olympic lifter and I don't have very straight elbows. That's what I was always called on. So you would try and elevate and depress the scapula without bending the elbows, and then holding on to, oh, you're bringing us over there.
I can do it. I can do it.
You can do it.
I have everything. Well, let's see here. I have to zoom out.
So holding on to the band or whatever you have, elevation and depression of the scapula. Again, they're coming out like little wings, pulling them down and back up. Good, with no elbow bend. No elbow bend yet. Good, just elevation, depression. Good. And then I would move into, once they get that, then I would move into the actual lat pull down. And again, it would be a chunky movement all the way. It would be that elevation, depression, lat pull down, and really getting them to focus on the movement of the scapula, because I find too many people turn it into an anterior exercise when it should be a posterior exercise. Nice. Good. And as a trainer, if I was one-on-one with someone, I would tell them that I would be there. Probably I'd be helping trace their shoulder blades out so they could kind of get more of a tangible feedback. Again, I don't know what that's going to look like in this post-COVID world when we're back, but we'll see.
Yeah.
I'm just looking at the time here. Okay. There's just so much to say and talk about. I'm going to show one more thing quickly. So when we do those rows, especially the lat pull down, another thing that people need to think about too is if they do have that separation and it's bad enough, a lot of times people want to pop their ribs and they want to do this big curve in the back to really try and get the lat pull down. But the thing you want to notice for especially postnatal moms is you want to bring that rib cage down. So you want to unpop those ribs, bring the ribs, think that they're attached by 2 little strings to the hip bones, and really get them to control the spine here. We don't want to stretch that out more. We want to bring this in. Okay, one last thing I'll show, and then we can kind of, if there is any questions, you can go. So whether someone has DR or not, especially at home, if they want to, any kind of hands and knees work, whether it's cat, cow, or whether it's bird, dog, has generally so far in studies that I've been able to see are generally okay for still keeping the rectus abdominis and not a lot of pressure. So another good row idea, if you still wanted to work on back but you had dumbbells, would be to row from this 4-point position. So yes, the weight would relax, but really that's fine to me, especially if you do end up having, I only have 5-pound dumbbells in my house right now, but say you have a 10-pound, it's really good because you can still focus on squeezing the scapula and then keeping your back and your core nice and steady and just strong all together. Good. And again, it's kind of like when you do those chest press where, floor press where you have really heavy dumbbells and the floor stops you and you push it up. This is almost like a floor row where the dumbbell stops you. So.
I had the 2.5s. See.
There you
I
go.
clearly grabbed them too quickly. I was like, oh, let's put right at once.
Effective shoulder work.
That's pretty good.
So yes, I mean, there's so much. I have so many things like in my head that I would share, but those are some main ones that I would give someone to really help with getting back into their postnatal fitness journey and being safe, but also effective.
This is great. Like I actually I will steal all these exercises. I will use all the exercises from you. And also like promote with you as well. And that way we can kind of complement each other's services too, which is awesome. But I like the way you cue things because I'm not the easiest person to follow instructions. So if I can follow the instructions, that means the person giving the instructions is doing great. So
I like to use a lot of metaphors. Helps me more.
Yes. Thank you so much for doing this. And like, I think it's a great thing for everyone to try. And hopefully everyone was trying some of this stuff out, which is pretty easy to do with minimal equipment. You don't need too much, a couple dumbbells and some bands. And my question is like, how do you, and just quickly, like a minute, I think we've got a minute left, but like, how would you progress somebody? So like for a physio's perspective, we're like, if you can do it right and it's not too taxing and it's not painful, then progress. Would it be kind of the similar thing for this specific population?
Yeah, for sure. Like, so I used to have a Fit Moms class that I ran, and there'd always be like a level 1 class, then level 2, they would move into more like, I would teach them how to barbell squat with the barbell on their back. They'd have heavier weights for RDLs. Maybe they'd get more into inverted, different kind of row techniques. So yeah, I mean, I would progress into regular strength training with really strict form, and then also still reminding them about the basics, pelvic floor, TA. Yeah.
Okay, great. That's good. I'm definitely going to be asking lots of questions in the future here.
Awesome. Yeah, and I think too, like everyone would start out, you know, basic, like every strength training, you know, you'd start with your hypertrophy phase and then, your anatomical adaptation again, because you got to start from square one, then your hypertrophy, then maybe your strength, and then you go into dynamic movement. Like dynamic movement would probably be your last goal for postnatal.
No, it's great. This is awesome. Thank you so much. I feel like it was a treat to have you come in, and can't wait to give you, like, instead of a virtual high five, like an actual physical high five. And like to see you at the gym again. So that'd be great.
Yeah, that'd be great.
For sure. Appreciate it. Thank you so much. Yeah, I'm just speechless. I'm just very happy today. So
awesome. Thank you so much, Sunny. And
no problem at all.
If anyone has questions, I'll try and answer them on any of your
Yeah, sure. I'll forward them to you if I don't know how to answer them.
Sounds good.
All right. Thank you so much, Megan.
All right. See ya.
Bye.